Doctor warns, the 5 medical checkups I would never get after age 60. If you are over 60, walking into a clinic for a routine screening might actually be the most dangerous thing you do this year. Most seniors believe that more testing equals more safety, but new 2026 clinical data reveals that after a certain age, many standard medical checkups enter the zone of negative return. This is where the risk of overdiagnosis and surgical cascades far outweighs the potential benefits of finding a slow-growing issue. You are likely one unnecessary scan away from being pushed into a series of invasive biopsies and aggressive treatments for a condition that would have never harmed you in your lifetime. You need to identify these 5 red flag checkups immediately, because for a senior, the search for problems can often become the very thing that destroys your quality of life. You won't want to miss the final habit, or 99% will miss the last tip and will be stuck with medical overtreatment for life. The first checkup I would never get after age 60 is the general full-body CT scan. In the medical world, these are often marketed as peace of mind, but they are actually anxiety engines. These high-resolution scans are almost guaranteed to find incidentalomas, tiny, harmless nodules or spots on your lungs, liver, or kidneys that have been there for decades. In a younger person, these might be ignored, but in a senior, they often trigger a biopsy spiral. You end up undergoing invasive needle aspirations and surgeries for shadows that were never going to turn into cancer. The radiation exposure alone from these scans can actually damage your vascular elasticity, doing more harm to your heart than the scan could ever prevent. The second screening to reconsider is routine PSA testing for men over 75 or those with limited life expectancy. While prostate health is vital, many prostate cancers in seniors are so indolent, slow-growing, that you are far more likely to die with them than from them. The brutal truth is that once you start the PSA cycle, a slight elevation often leads to aggressive radiotherapy or surgery. These treatments can leave you with permanent incontinence or vascular impotence, destroying your independence and joy for a disease that would have remained silent. Doctors in 2026 are moving toward active surveillance, because after 60, the side effects of the cure are often more lethal than the ailment. The third is routine colonoscopies after age 75-80. While early screening saves lives, the mechanical risk of the procedure increases significantly as you age. Your bowel wall becomes thinner over 60, and the risk of perforation during the scan can lead to emergency surgery and sepsis. Furthermore, the prep process, the intense dehydration required, can trigger acute kidney injury or a heart arrhythmia in a senior body. If you haven't had a polyp in 20 years, the statistical chance of a new cancer developing and becoming dangerous in your late 70s is lower than the risk of the procedure itself. However, many seniors find that even when they avoid unnecessary medical stress, they still feel heavy and inflamed because of thermogenic resistance. This is a common 2026 health crisis where your internal fat-burning furnace has dimmed, making your body feel oxygen-starved and prone to holding onto metabolic waste. A lot of my viewers are getting great results with a new breakthrough called Citrus Burn. It's a 100% plant-based formula that helps break through that metabolic wall. One thing that's helping thousands right now is how it uses Seville orange peel to boost that internal fire. If you want faster results without feeling deprived, this is what I recommend because it helps activate fat burning even while you're sleeping, and it comes with a 180-day money-back guarantee. The fourth checkup trap is frequent bone density scans, DEXA, for low-risk women. While monitoring osteoporosis is important, getting these scans every year often leads to the overprescription of bisphosphonate drugs. These medications, while helpful for some, can actually cause micro cracks in the jaw or femur if used for too long. For many women over 60, focusing on resistance training and balance exercises is 500% more effective at preventing a fracture than a yearly scan that only results in more pills. You don't need a scan to tell you that movement is medicine. Fifth is annual EKG screenings for asymptomatic seniors. If you aren't experiencing chest pain, shortness of breath, or palpitations, a routine EKG is notorious for false positives. It might show a minor, harmless electrical blip that has been your normal for 40 years. This leads to stress tests and cardiac catheterizations, invasive procedures where a tube is literally threaded into your heart. For a senior, these invasive explorations carry a real risk of vascular tearing or stroke. Unless you have symptoms, your heart's electrical rhythm is often best left unprodded by unnecessary technology. If you're finding it hard to stay active because your heavy legs or intense weight plateau is making movement feel like a chore, one thing that's helping thousands right now is citrus burn. It is specifically designed to reduce those intense cravings by up to 54%, making it much easier to stay light on your joints so you don't feel the need for excessive medical monitoring. Plus, they're offering 2 free bonuses right now: the Rapid Detox Protocol and Mind Over Metabolism Mastery. These are perfect for cleaning your system from the inside out so your biomarkers stay naturally healthy. It's 100% plant-based and contains no stimulants, which is vital for senior heart health and keeping your blood pressure stable during your necessary checkups. Furthermore, we must address aggressive A1C targets. Many doctors try to push seniors over 70 to have the blood sugar of a 20-year-old. This checkup focus leads to overmedication with insulin or secretagogues, which causes severe hypoglycemia, low blood sugar. For a senior, a sugar crash is far more dangerous than a slightly elevated A1C, as it leads to sudden falls, cognitive confusion, and heart attacks. You need a doctor who understands that senior blood sugar should be managed with a gentle hand, not an aggressive pharmaceutical hammer. If you are struggling with a weight plateau that makes your metabolic markers look worse than they should, one thing that's helping thousands right now is the biggest discount on the 6-bottle pack of Citrus Burn, which currently includes free shipping. This 2026 formula helps break through thermogenic resistance by activating your body's natural heat production. When you carry less visceral fat, your inflammatory markers drop naturally, often making those scary tests completely unnecessary. It's the perfect natural solution for a 6-month stability reset with a 180-day, 100% money-back guarantee. The final habit that 99% of people miss is the value-based conversation. Before any test or checkup, you must ask your doctor, how will the results of this test change my treatment plan, and what happens if we do nothing? If you miss this last tip, you are a passive participant in a medical system designed for volume over value. Most doctors order tests out of defensive medicine or habit. By asking these 2 questions, you force a risk-benefit analysis that protects your body from unnecessary trauma. This simple habit seals your medical safety and ensures that every intervention you choose is actually designed to help you live longer and better, not just fill a chart. It's time to stop being a test subject and start being the CEO of your longevity. Subscribe. Which advice will you start applying today?